Venezuelan President Nicolás Maduro has stressed the high number of patients who have recovered from COVID-19 in the country. The number of confirmed COVID-19 cases worldwide has now surpassed 2 million, according to the latest data provided by the Johns Hopkins University. The Democratic Republic of Congo has reported a second Ebola death following more than 7 weeks without a single case. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. Venezuelan President Nicolás Maduro stressed the number of patients who have recovered from COVID-19 in the country is high. He also mentioned that medical centres have enough beds and intensive care units to treat patients.
There is a positive development. 110 patients have recovered. This is a 58% recovery rate, one of the highest in the world. A 58% recovery rate. Today the order I gave was fulfilled. All coronavirus patients must be in hospitals, CDIs, or in private clinics. They are all hospitalized, receiving medical care. No one is at home. No one should be in their houses. We can manage this situation. We have 23,500 hospital beds, 23,500, and over 4,800 intensive care units.
And Venezuelan Vice President Delcy Rodriguez offered a daily report on the efforts coordinated by the Presidential Commission for the Control and Prevention of COVID-19.
We have noted that with these 8 new cases, of which we have offered details, Venezuela has reached a total of 189 cases at the national level, fortunately maintaining the flattening of the curve.
Healthcare professionals in Colombia are calling on the state to provide protective equipment following the deaths of 2 doctors and an ambulance driver in the midst of the coronavirus epidemic. On Sunday, Colombian health personnel rejected a decree issued by President Ivan Duque, which orders all health personnel and even those still undergoing their professional training to treat COVID-19 patients without the minimal protective elements to prevent contagion, as recommended by the World Health Organization. 35 trade union organizations of the country, gathered in the Coalition for Human Talent in Health, signed a public letter condemning the presidential measure and holding Ivan Duque responsible for the risks faced by those on the front line of the fight against the coronavirus. The number of novel coronavirus cases in Latin America continues to rise. Brazil continues to be the hardest hit country in the region, with a total of 22,720 COVID-19 cases and a death toll of 1,270. Brazil ranks 14th in the world in terms of the number of cases reported. Meanwhile, Ecuador, with over 7,500 cases, remains in second place in the Latin American region, despite having a population 12 times smaller than Brazil. Chile follows with more than 7,000 cases. Peru and Mexico come next in the region with over 7,000 and over 4,000 cases respectively. Panama continues to be the worst affected Central American country with 3,400 cases. And in the Caribbean, the Dominican Republic has reported the highest number of COVID-19 infections at over 3,100. The Ecuadorian Health Ministry has reported around 7,000 COVID-19 cases and an official death toll of 333, but local reports indicate that the real figures could be much higher. Our correspondent in Ecuador, Denise Herrera, brings us more on the latest government measures to face the economic impact of the virus.
Ecuador has now around 7,000 cases of the new coronavirus, and around 300 people have died because of this new virus. The Ecuadorian authorities have also informed economic measures. The president of Ecuador, Lenin Moreno, recently announced that he will create a new national account to face the sanitary crisis. Moreno said that all Ecuadorian citizens who have a salary more than $500 have to give a special contribution, as well as the public workers who have to give the half of their salaries. Several social organizations of workers have rejected these new economic measures. They said that Moreno are also benefit the private sectors. We should remember that organizations of workers have been rejected this agreement before between the IMF and the government. In this context, also the authorities who are leading the removal of the bodies who have died because of this new virus said that around 1,000 bodies of people who have died because of the new coronavirus have buried. In this context, are still the citizens from Guayaquil denouncing that these numbers are not official, are not the truth. They are still denouncing that the government didn't help them, and they are claiming help. They want to give to their relatives a dignified burial. In this context, so the government said that they are taking all the preventive measures to stop with the spread of this new coronavirus. Meanwhile, different social sectors are saying that the government is not saying the truth.
St. Lucia has been working to track the sources of infection of all COVID-19 cases and prevent deaths. A partial lockdown remains in place until April 26 with a 10-hour curfew.
As of April 12, 2020, St. Lucia has recorded a total of 15 confirmed cases of COVID-19. The first 2 cases were repatriated to the United Kingdom between March 24th and 25th, and 4 of our remaining cases have since recovered and discharged from hospital care. Last week, the public health team at the Ministry of Health also took the opportunity to step back, review what has been put in place, assess our position in that famous curve, analyze the data so far, and prepare the strategic pathway on the way forward with our national response for COVID-19.
A second group of Cuban medical personnel has arrived in Turin, northern Italy, to support the efforts to contain the coronavirus. The latest medical brigade was welcomed by the city's mayor and other Italian authorities. The first medical brigade sent by Cuba to Italy arrived on March 22nd and has been working at an emergency hospital in the town of Crema, Lombardy, to support overstretched local hospitals in the worst-hit region by the COVID-19 epidemic. Over the weekend, the Cuban government also sent a medical brigade of 11 doctors to the West African nation of Togo to support its fight against the coronavirus. This is the first time Cuban medical personnel have been deployed to the country, and the move came in response to a request from the Togolese government. According to WHO figures, Togo has reported 77 cases and 3 fatalities. The Dominican Republic's Electoral Commission announced that the country's presidential and legislative elections, originally scheduled for May 17th, have been postponed to July 5th due to the coronavirus epidemic. Some 7.5 million Dominicans are eligible to vote in the elections. On July 5th, the President, Vice President, 32 senators, 190 deputies and 20 members of the Central American Parliament will be elected. Last week, the Electoral Commission started a round of consultations with political parties in the face of a possible date change. According to the Dominican Constitution, a change of government must occur by August 16th, so the elections and a possible second-round vote cannot be further delayed. Meanwhile, President Danilo Medina signed the extension of the national state of emergency until April 30th this Monday due to the rising number of coronavirus cases. More stories coming up after this very short break, so don't go away. Welcome back to From the South. The number of coronavirus cases continues to rise in the United States, now the center of the pandemic. The US has now reported more than 577,000 confirmed COVID-19 cases and over 23,000 deaths. According to a top US health official, the country is nearing the peak of its coronavirus outbreak. Around 2,000 fatalities have been reported for the past 4 days in a row, the largest number of them in and around New York City. New York State Governor Andrew Cuomo announced the state's coronavirus death toll has surpassed 10,000. Cuomo warned against easing social distancing restrictions too quickly, as President Donald Trump reportedly seeks to reopen the economy by the end of the month. Cuomo stressed the state authorities would listen to experts to determine when to relax restrictions, striking a delicate balance between restarting the economy and still protecting public health. Reports have revealed that the novel coronavirus epidemic in the United States is disproportionately killing African Americans, exposing the inequalities in access to healthcare in the country. More in the following report.
The figures speak for themselves. Black, Native, and Hispanic communities are by far more affected by this disease than any other ethnicity. For example, in Michigan, the Black community represents only 14% of the population. However, 40% of the fatalities for COVID-19 are Black. Same situation in Chicago, where 29% of the population has darker skin, but of all deaths due to the novel coronavirus, 72% are African American. The leading spokesperson on matters of public health in the federal government, Dr. Jerome Adams, was very clear on why this is happening.
In New York City, Hispanics represent the majority of deaths. In Milwaukee County, blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and Black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack.
The United States is already the country with the highest number of deaths due to COVID-19, surpassing Italy. In less than 2 months, the biggest economy in the world went from 0 to more than 10,000 lost lives. The low-income communities have also been hit by the fact that many people have lost their jobs and they have applied either for unemployment aid or food stamps to be able to feed their families. But these figures show how racism and inequalities make the death toll disproportionately Black.
There's no doubt systemic racism in our society still, and there's systemic structural inequality in our healthcare system.
At the same time, the segregation in terms of jobs is a reality in the United States, where Black and Hispanic workers are much less likely to be able to work from home. More than 367,000 people have been infected with the virus, but the pandemic is far from over in this country.
The number of confirmed COVID-19 cases worldwide has now surpassed 2 million, according to the latest data provided by the Johns Hopkins University, which monitors statistics internationally. As such, the number of people infected by the coronavirus has doubled in just 10 days. Meanwhile, in Europe, the hardest hit region in the world, some governments are considering lifting lockdown restrictions. More details in the following report by CGTN's Ira Spitzer for Telesur in Berlin.
Countries face difficult decisions in the coming days and weeks as they consider whether and how to loosen the restrictions on public life, which have been in place because of the coronavirus outbreak. Europe has been hit extremely hard by the global pandemic, but what we've seen in certain countries over the past few days has been a flattening of the infection curve, and that has led politicians and others to start trying to decide how to go forward with restarting the economies and getting people out of their houses and back to something resembling a normal life here in the 2 hardest hit countries, Spain and Italy. We are seeing some changes. Spain will allow non-essential workers, certain non-essential workers such as construction workers who are unable to work from home to, in some cases, return to the job. In Italy, some shops are now opening. We've also seen loosening of restrictions in Austria, the Czech Republic, and Denmark. Here in Germany, leaders will discuss that possibility on Wednesday. So it really is something that the continent is grappling with, but the tremendous risk here and the worry for people as well as politicians is a possible second wave of infections. So that really is the question as the countries consider their options here. Ira Spitzer, CGTN for Telesur in Berlin.
Meanwhile, China reported its highest number of new coronavirus infections in weeks on Monday. The Chinese authorities are determined to preserve the progress achieved in the fight against the COVID-19 virus, and the top priority now is to avoid a second wave of infections, as explained in the following report.
Increase in imported and asymptomatic cases of the novel coronavirus in China, which now exceed 1,000, has authorities on high alert, faced with the possibility that they could spark a second wave of infections that severely affect the achievement reached in curbing the spread of the virus.
In recent days, the number of confirmed cases in some neighboring countries has increased rapidly, and the figure of imported cases has risen significantly. Therefore, we must adopt strict measures of inspection and isolation of incoming passengers to ensure timely detection and treatment in order to minimize the possibility of a second wave of infections.
To control cross-border infections, mostly of Chinese nationals returning from other sources of infection, customs are now on the front line of the fight against the disease. China temporarily banned the entrance of foreigners and closed its land borders with Russia.
The authorities have strictly limited unnecessary cross-border movements of people. All the land border checkpoints have prohibited the exit and entry of people from countries severely affected. Strict border controls were established. The issuing of entry and exit certificates for non-essential reasons was suspended, and we advised people to avoid unnecessary border crossings, such as for tourism and to visit friends.
Regarding asymptomatic cases, the epidemiological controls on the contacts of infected people have been reinforced, and citizens are encouraged to continue to follow prevention measures like the use of face masks and social distancing.
Here, the situation is improving, but at the same time, people are advised to continue to use face masks, adopt protection measures, take their temperature, avoid unnecessary gatherings, and report any symptom of the disease.
China, which at one point of the epidemic reported more than 15,000 new cases and almost 300 deaths in a single day, is now considered to be in the control and mitigation stage of the epidemic and is attempting to return to normality. As such, the main objective today is to maintain its achievements and prevent a resurgence of the epidemic.
The International Monetary Fund announced immediate debt relief for 25 countries to help them free up funds to fight the coronavirus pandemic. According to Kristalina Georgieva, Managing Director of the IMF, the Catastrophe Containment and Relief Trust will provide grants to the poorest and most vulnerable IMF member countries to cover their IMF debt obligations for the next 6 months. The countries that will receive debt service relief are Afghanistan, Benin, Burkina Faso, the Central African Republic, Chad, Comoros, Democratic Republic of the Congo, the Gambia, Guinea, Guinea-Bissau, Haiti, Liberia, Madagascar, Malawi, Mali, Mozambique, Nepal, Niger, Rwanda, Sao Tome and Principe, Sierra Leone, the Solomon Islands, Tajikistan, Togo and Yemen. The IMF, together with the World Bank, has called for rich nations to stop collecting debt payments from poor countries from May 1st through June 2021. And we're taking one final break now, but stay with us for more. Welcome back to From the South. The Democratic Republic of Congo has reported a second Ebola death following more than 7 weeks without a single case, according to a World Health Organization report issued this weekend. The DRC had been due to officially announce the end of the second deadliest Ebola outbreak on record until a case was confirmed last week in the city of Beni. The outbreak has killed more than 2,200 people since August 2018 in an area of the country where militia violence has hindered efforts to contain it. The latest victim was an 11-month-old girl who was treated at the same health centre as the previous case, a 26-year-old man. According to the WHO, flare-ups or one-off transmissions are common towards the end of Ebola outbreaks, and a new case does not necessarily mean that the virus will significantly spread again. Meanwhile, the Congolese authorities are preparing in the face of the increase of novel coronavirus cases in the country, which have already reached 235, while 20 people have died.
The death of a second victim treated at the same facility was reported later on Sunday. Facing the threat of 2 different viruses, has left already wary doctors fearful for what's to come. These Congolese firefighters.
The African nation of Lesotho has yet to report a COVID-19 case and is one of just 2 African countries to remain virus-free. However, the Lesotho government, led by Prime Minister Tom Tabane, has rolled out a series of economic measures to cushion the country from the impact of the pandemic. In an address on Monday, Tabane informed that a budget had been allocated for a disaster relief fund, with another relief fund for the private sector. Like other African countries, Lesotho has formally opened talks with the World Bank and the European Union for assistance in the face of the coronavirus pandemic. Local banks have also been directed to revise some regulations, while telecom companies are to lower their rates. The island nation of Comoros is the only other African country to have so far escaped the COVID-19 pandemic. And there are now over 14,000 confirmed COVID-19 cases in Africa. According to Johns Hopkins University and the Africa Centers for Disease Control and Prevention, 788 people have lost their lives to COVID-19 on the African continent, while over 2,800 people have recovered from the virus. Nigerian President Muhammadu Buhari announced the extension of the coronavirus lockdown this weekend. The Nigerian leader declared that the quarantine originally set for 14 days will continue in Abuja, the capital, as well as the city of Lagos and the state of Ogun for as long as necessary. Buhari stressed that the lockdown may even be extended to more states, as the number of confirmed cases in the country has reached 323, and informed that anyone failing to comply with the measures will be arrested. The Nigerian government announced the distribution of 70,000 tons of grains to those most in need. 70 COVID-19 patients have been discharged so far in Nigeria, while 10 people have died. Coronavirus testing has resumed in the Gaza Strip after the Israeli regime allowed the delivery of 5 testing kits purchased by the World Health Organization. So far, health authorities have confirmed 13 coronavirus cases in Gaza, all of whom are in quarantine. Meanwhile, library volunteers are distributing books to children under lockdown in the Deir al-Bara refugee camp.
The books and stationaries to the homes of the friends of the library. Given the fact that they cannot go to the library due to the current coronavirus crisis, we distribute the books every Saturday and we collect them on Tuesdays. We then discuss the stories with them online. The idea of Bicycle on Life is ours came after that some people called the library and asked for books, but we weren't able to deliver it to them as the library was closed for a certain amount of time due to the spread of the coronavirus.
And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss and thank you for watching.